What I would like to do for just a few minutes is to try to explain why I believe the process, what we call the Biodesign process, works. So what's unique in the innovation process about medtech, about health tech, has to do with this issue. So at universities, at companies, there is a great deal of important technology push innovation. Someone discovers a new platform, and then they look for an application, in our case, a clinical application to that. The whole point about the innovation process in health tech is that there's a mirror image process that's really robust and really important. And that is that if you start with a clear understanding of what the clinical need is, you can be pretty much guaranteed to come up with a technology that will match it. That is the core difference and the distinct soul of the Biodesign process. And so it's an extremely complicated landscape. There is not a single user. And for that reason, we broke out the design thinking process with an emphasis on the first stage of identifying needs, finding needs, and then screening them. In healthcare, pretty much any need that you come across is going to be a compelling need. These are things that are affecting patients, they're hurting patients. And so it's easy to get attracted to a need that you just come across. And so the point is you need to be extremely careful about picking the need in the first place. And the best way to slow yourself down and make sure that you're picking a good need is to have a number of needs to choose from so that you can compare them. It allows you to be a little more objective in picking the need that you're going to invest the next 10 years of your life. The finding of the needs is not the hard part. What's hard is to prioritize them and pick out that one or two or three needs that you're going to go forward with. The important step is filtering the needs, is allowing those needs to compete in a semi-quantitative way so that you wind up with a small handful of really rich, really potent needs. We put one other layer of mechanism on this, and that is need criteria. So what are the characteristics that a good solution has to have to satisfy that need? And we break this down into must-haves and nice-to-haves. The must-haves are the critical ones. Those are the factors that are absolutely essential to addressing the need. And importantly, this is a contract with yourself that you are not going to go forward with a solution unless it meets these must-have criteria. The important groundwork is done, and I love what this team said a few years ago. If you have the need right, given enough time, sugar, and caffeine, you will invent something. So with concept processing, we take another page out of the design thinking methodology and filter again. So we ask our teams to come up with multiple solutions. This graphic shows an input of 3 different needs and developing several concepts that would solve each of those needs, and then allowing all of those concepts across those 3 needs to compete with each other to come up with one final solution. And then here's another interesting aspect of the process that's different than the way a lot of companies work anyway. So it's only now that we're bringing in intellectual property. This is pretty late in the process, as you'll appreciate. And that's done on purpose because we think that too early a look into the intellectual property can be unnecessarily discouraging. It can take you away from a path that could be productive. So we save intellectual property till the end. And what we're most proud of is the statistic at the end. So we are keeping track of the number of patients who've been reached by the technologies coming out of the program. We're well over 3 million now, and that's a steeply ascending curve. So that to us is a proof that the psychology in the process is working out decently. The nice thing about this training process is it's repeatable. And in our sector of health technology, and if you're a young person in your career, you'll have a chance to do this, 6, 8, 10, a dozen times during your career. And that's what's exciting. That's what we're really enthusiastic about as you launch the Rambam program. So that's it for me. Thank you very much. Good luck and enjoy the process.